It all okay. It's, yeah.
Right?
I think so.
Yeah, yeah.
I think so.
Yeah, this will be.
Yeah. Got a couple minutes here. Should I move down one?
It's just like, if somebody wants to sit, it's fine, I can sit, it is, I don't have to sit in the bars. You know what I mean? Like, it's very comfortable.
Yeah, it's not the best, yeah.
I don't think I agree with it.
Oh, are they doing coffee at Mia Bar?
The best. cafe
Really? I
cafe.
didn't even check.
It's so
them out.
When I was in law school, the only location was the one that's like on the corner on 34th and University, and their cafe con leche that got me through law school.
Oh, no. Hey, how's it going? You have like time constraints, but we don't question.
Are you Darren? We've never actually met. I'm Hannah. It's nice to meet you. I just see you always in the chat and I'm like,
Yeah, oh, yeah, it's nice to meet you.
it's nice to meet you.
Is this okay, Rough City?
Oh, absolutely.
Perfect, thanks. Okay, so do we get started? Are you guys cool with that?
Yeah, I think Tom will be here shortly. Let me shoot him a quick text.
Well, can we just do some housekeeping real
Sure.
quick? So, I don't know if you saw my email. I saw that you said that you have multiple proposals today.
Yeah.
So we have a couple big ones.
Yeah, you
and-
guys can go first.
Yeah.
That's perfectly fine.
Okay.
Yeah.
And also, this is Derek. He's the person
Hey,
that
how are you?
he'll be speaking on behalf of one of the proposals.
Okay.
So I'll introduce him when we're about to do that. Also, I had asked you about the, in the worst case scenario, if we were to be decertified, what would happen to the RTs next spring?
Right.
Do you have any,
So we've had like 3 different meetings on not just that topic, but about decertification in general,
Okay.
and we're still seeking specific legal advice.
okay,
We had a big meeting with multiple, counselors on that. I'm not trying to be evasive. We're kind of in somewhat uncharted territory.
That's
So
fair.
I don't have a complete explicit answer for you just yet. We're still working on it though. We're actively meeting about it. There's Dr. Gallagher.
okay. And also, for next time, I think we should sign a MOU to extend the current CBA, right, until we've reached a agreement here.
Have we done that in the past? Is that necessary?
I think we can just operate under the one that we have.
Is
Yeah.
there no need for?
Yeah.
Okay,
Yeah. I mean, I think there's an assumption of evergreen application until such time as we reach a new agreement. I don't think we have a specific evergreen provision, but I don't know if it's necessary.
I'm sorry, I'm late.
1 minute.
It felt like I'm really late. Everyone's late.
We're good whenever you want to start.
okay. So first thing that we'll, I guess, present about is healthcare.
Okay.
It's like the biggest proposal that we have today. Well,
Do you have enough physical copies or is it just?
I do, but we did a lot of research and we also conducted a
Okay.
survey of our
Okay. So you're gonna
unit.
put it up there?
Yeah, I mean, so just to contextualize the proposal, like I just wanna present a bunch of stuff first.
Okay.
And then we'll go through the actual proposal itself and
Alright.
I'll give it to you. Zoom will cooperate.
Should be good to share screen.
Yeah, I know, but my computer is screwing up. Okay. Okay, so, I'd just like to start off by saying that we have a few priorities to address, through this proposal. One of them, is, I mean, two of the biggest ones, are like gaps in what we have in terms of, insurance at the moment. Those would be dental and vision. We also have a priority in reducing the emergency care deductible. And we also want to address out-of-network coverage, especially focusing on hospital services and also the out-of-area plan, ensuring that people in the out-of-area units have tier 3 coverage. And we would also like to have cheaper dependent coverage. So just to present an overview, we conducted a survey of our bargaining unit, about 10% of the unit. The respondents came from all the colleges, most departments, so it's fairly representative sample. And what we found from the survey itself was that about a little more than a third of GAs are unable to afford healthcare expenses, and 40% of them have skipped medication at one point or another, and 7% of them skip medication frequently. 6.5% have taken out loans to pay healthcare expenses, and on average, they spend about a little more than $200 per month on healthcare expenses. And also, 28% of them have had to travel to another country to access cheaper healthcare. We also have lots of people who shared their stories as well. So I'll be sharing some of the quotes from what they have shared from their experiences. So one person has said that I've not gone to an eye doctor since graduating, since starting graduate school, because it's not covered. I cannot afford it. I also avoid dental procedures for the same reason. Another person said that they've incurred debt because of this as high as $1,000. Another person mentioned that I need new glasses, I can't afford to go to the eye doctor, and I need help paying for dental. Going to dental specifically, slightly less than half of graduate assistants have declined dental care because they were unable to pay for it. And 68% of GAs don't use the free cleaning and exam that's currently offered through the dental program of Gator Grad Care. And I can give you a few quotes as to why. And GAs who require dental care are spending about $1,000 a year on dental care. And one of the reasons why people aren't using the current program is, as one person said, the quote unquote free dental cleaning and exam at faculty practice isn't free. It costs $88 if you are a patient, and after becoming a patient, subsequent visits may be free annually. Another person noted that we do not get orthodontic care when you have problems with past orthodontics, i.e. retainers, breaking, or needing additional support. It's all out of pocket and high cost. Another person shared their story saying, last year I had a dental emergency that required immediate care. Every emergency dentist option in Gainesville, Jacksonville, Orlando area was out of pocket. I turned down 10+ dentist options because the cost of exploratory exam I needed at ASAP was not available via Gator Grad Care without knowing the cost of treatment it was around $300. I ended up visiting a US free teeth pulling clinic to receive care, meaning I essentially had to play dentist and diagnose that I needed a tooth pulled. That was not the treatment I needed, and I ended up needing in order to be seen by a dentist as soon as possible and receive the prescription-based care that I needed. Another person mentioned that they had broken tooth, which required a crown that would cost $2,000. He says, I lived on painkillers for a year until I traveled back to my home country. And lastly, another person noted that they had to use a student loan to pay for a root canal and crown replacement because my cavity was severe and I was told I would have been at risk for blood poisoning if I had waited any longer. For when it comes to vision care, slightly more than a quarter of GAs have declined vision care because they were unable to pay for it. You know, we're also staring at screens all day, so about 60% of us require prescription glasses. Of the GAs who require vision care, they are spending about $438 a year on that. And when it comes to vision care, there aren't as many kind of harrowing stories as with the dental or emergency care, because vision care is mostly just about getting glasses. But it's mostly the prohibitive costs that concern people. So one person said that I tried to apply for Humana Vision insurance, but because of the 20-hour work week in my contract, I was not allowed to. It has to be around 30 hours, I believe. I used to be a Teams member, so full-time, I was able to use the Humana Vision insurance plan. When I became a student here, they didn't let me renew because of this 20-hour stipulation in my contract. Another person noted that they had paid $700 for an eye exam. When it comes to emergency care and hospital services, we also have lots of stories here. I just chose a few. One person said that I've had to set up payment plans despite going to the ER for approved instances. Another person said that I needed to go to the emergency room in Wisconsin. I was pretty sick, but before I had to go, I called Gator Grad Care to make sure they will cover the visit. And they told me they will cover it, but at the end of the month, I received a bill of $480 when they only gave me steroids after telling me they didn't know what was wrong with me. Another person who needed stitches after a cut said I put $200 copay on my credit card, but the interest is gonna kill me. Another person noted that the emergency room fee was a significant financial hardship that impacted my budget for months. And another person mentioned that this year my wife had to go to an out-of-network emergency room and we were charged about $1,000, which we are still trying to negotiate. When it comes to out-of-network coverage, 22% of graduate assistants have gotten out-of-network care at some point. And one of the biggest concerns related to out-of-network coverage is the fact that many of people have noted that in-network psychiatrists and therapists are difficult to find or even get an appointment with when they do find them. Other reasons have to do with the fact that GAs have to travel for field work. GAs also travel to visit their family. And other people just really value their doctor-patient relationship and don't want to switch providers when they switch over to Gator Grad Care. So I'll just share a few stories here. One person said that in the summer of 2022, I could not afford to go to the hospital, so I didn't go. I was on a trip with family and out of network. I was incredibly sick for a whole week, the sickest I've ever been. I had tachycardia, bloating, extreme gas, diarrhea, vomiting. It was incredibly bad. And I probably should have seen a doctor, even if it was only food poisoning. There's usually, another person notes that there's usually a minimum of 8 weeks before the next available appointment. I'm also with a primary care physician on the other side of town that I've never met because my doctor left. And I was told that UF Health was not taking any primary care patients when I decided to move locations. Another person noted that I ended up dipping into my savings this summer and spent something like $1,200 out of pocket for x-rays and rheumatology. Another person noted I had to turn down care because insurance did not cover doctors out of network. Someone who was in a car accident said they went to CareSpot and I was told that they did not accept insurance for car accident related checkups. And I was directed to go to the ER down the road, which is out of network, but my car insurance is in the process of covering the cost. And I just want to drive home the point about mental health care. I mean, grad school can be very taxing on our mental health. It's a serious problem among GAs. And one of the biggest issues with Gator grad care people have noted is the lack of access to mental health care. We do have Talkspace, and which is a kind of telehealth kind of program for mental health care, but and that has mixed reviews. Some people like it, but some people really want to see someone in person. So one person said that I have been referred to for a therapy a few years ago, but I could not find in-network therapists. Another person said, I see my therapist who is out of network twice every month, and that amounts to $300. Another person noted, I actually called Gator grad care to check whether a specific therapist is in network. I got a confirmation and I got billed the full amount of $120 per session. And that seems to be a common story, like $150 to $120 per session. Another person said, even at a discount, therapy was unaffordable for me out of network. Another person shared their story saying, I see an out-of-network psychiatrist every 2 to 3 months for the maintenance of medication. I went out of network because the waitlist for an in-network approved psychiatrist was 2 months when I first arrived at UF, and I didn't want to wait. I continue with this option by choice. I love my doctor. Transferring doctors can be logistically difficult, and finding a suitable physician match can require trial and error. I could have taken the out-of-network appointment to hold me over and accepted the later in-network appointment to take advantage of the affordable in-network option available to me, but I've chosen not to because it felt like a risk worth taking, and this is care I cannot miss out on. Then there's the issue with people who work in research and extension centers, also called REC units. There are a lot of GAs who work off campus, places like St. Augustine or South Florida, really all over the state. A lot of them have noted that they don't get any information, especially about healthcare, and they're often reticent to get care because they don't know what's in network or what's out of network. Even when they call in, they don't. The people who pick up the line don't seem to know that there are off-campus students. So I'll just let them speak for themselves. One of them said that there are almost no resources for off-campus students, few providers for medical that will take insurance, no dental options at all, no options for outside specialty pharmacies. I've had to order my medication through main campus and have them shipped. Another person said it's been very difficult trying to help international students find healthcare providers that accept Gator grad care near our research center. Another person said that we feel like we are living on the moon. When we call the Gator care number, the person on the line doesn't even seem to know that we exist, that there are off-campus students in REC. Another person noted that there needs to be better options for off-campus students. I shouldn't have to drive 1.5 to 2 hours one way to receive healthcare. Someone who had to go to the ER, their expenses were barely covered for, and they said I was told that I'm lucky that they even paid for some. Some of these have to do with the fact that about the lack of information. If they had information, they may not have to travel 2 hours. So that's something that we would like to address. But there's also just the general problem of there are not providers nearby where they live. And lastly, for when it comes to coverage for dependents, about 15% of the people who were surveyed required coverage for dependents. About 43% of GAs are international whose dependents cannot get coverage elsewhere. For the most part, most people have one dependent or two dependents, usually their wife or child or both, or spouse and child or both. One person noted that my spouse has healthcare through his work, but when he was receiving it through my insurance, it was barely affordable. Coming back to the proposal that you gave us last time, we do have certain points that we agree with in your proposal. One is the automatic enrollment in Gator grad care with the option to opt out. I think that does go some way to addressing some of the problems that international students have in terms of adjusting to life here and getting everything sorted out. So I think that we're in agreement with that. And we are also agree that it makes sense to have another GA on the rebid committee. When it comes to reopening every year, we're really not interested in doing that unless there is a reopener with the intent to improve coverage and not just increase costs. So in our proposal today, there's no reopener, but we are open to having at least one reopener, or sorry, a maximum of one reopener, but again, with the intent to improve coverage.
Can I ask a clarifying question? real
Sure,
quick? So do you mean like with a single provision or a single term? Like when you say one reopener, I get the impression you're saying not the entire article. So can you just clarify that a little bit?
Yeah, a reopener for Article 12. Like you had said, and you had in one of your one of the things in your last proposal was to have it reopened every year.
Mhm.
Right? So that would not be, in our current proposal, there is no reopener for the
Right.
3-year period.
Right.
We could, if, we decide like, okay, there's still a lot more work that needs to be done in order to like sort out a plan that improves coverage. Let's, do the research or whatever, and come back to it in a year or two or something that we would be open to.
Yeah, like one, if I could, I think the answer is one additional reopener between full book bargaining where it gets open anyway.
But not dedicated to this article.
Dedicated. to this
Dedicated to this article, but open it a maximum of one time between the full books.
Yeah.
Gotcha. I understand. Thank you.
Sorry about that.
No, I get it. I understand. Thank you.
And in the last proposal, so you had created a table with basically what like the employee contribution to the premium is, what the employer contribution to the premium is, and like the full premium. And we agree that that's good information for us to know, but it's not what's directly being bargained for. And in order for that information to be useful, it also has to be contextualized with what the costs are this year, which you didn't include. So you did want to increase some of the employee contributions for spouse and family, but you didn't really show how the full costs are changing. So that would be, if it's for the purposes of informing us, that would be important information for us to have.
Okay.
But in any case, in our proposal, we've removed the premium and the employer contribution because that's not being bargained for here. What's being bargained for is the employee contribution. The premium is not being negotiated here at the bargaining table, and the employer contribution is only indirectly the result of the employee contribution and the premium, which is not being negotiated here. So in terms of our proposal, it's based on very extensive research of the dental, vision, and health plans that are, and also the premiums that are charged to other UF employees as well as Shands employees. And these are plans that are offered through GatorCare as well as through People First. For the dental and vision plans, we have an opt-in option for these plans. We've also provided example dental and vision plans in the appendices, and but those are just kind of examples of like what we're looking for. We're open to other plans as long as they satisfy certain criteria. This current proposal also is a proposal for comprehensive tier 3 coverage, but we recognize that that's not something that can be resolved very quickly. So for this, we are open to having a reopener as long as tier 3 coverage would be addressed in a future reopener. But for this year, we do want to prioritize the lower emergency deductible and also tier 3 hospital services, and also tier 3 coverage for out of area people. And lastly, cheaper coverage for dependents. So when it comes to the dental proposal, what we want is something akin to a prepaid plan. And I should say that, all of our research, we cited our sources. So when I send you this, you can follow up yourself. What we want for dental is something like a prepaid plan that satisfies the following criteria. Prepaid plan, you can only use in-network providers, but within that network, there's no deductible or annual maximum. And preventative care is at no charge mostly. And there is a fixed copayment schedule for basically all of the possible procedures. And orthodontics would be covered for adults and children. So the plan that we've included in Appendix G is the Humana prepaid plan, which is available to state employees through People First. But you know, anything of that sort is fine with us as well. We know that in Shands, 0.5 FTE employees are offered a Humana Advantage plan, which is relatively similar. So that's something we would be fine with as well. In terms of the costs, we calculated that based on for the employee only costs to be about a quarter of what is normally paid by other employees, and for the other costs to be about half of what's normally paid by other employees. And just, you know, keeping in mind the fact that, you know, our employee contributions are less than many other employees at the university, but that's also, as our research for Article 10 revealed, we are the lowest paid workers on campus, like pretty much any way you slice it, either on a per FTE basis, but also on a total basis, because we're all for the most part on 0.5 FTE. So yeah, that's something to keep in mind when, you know, pricing the employee cost.
Can I ask a clarifying question? If you go back for a second, so when you say orthodontic covered, do you mean just covered, or do you mean covered at 100%? Because that's not clear.
No, there's a copayment.
Okay.
Yeah, yeah, and I can show you the appendix. when
Okay,
we get
thank
there.
you.
Yeah. For the vision proposal, all of the plans that are offered through People First or to other UF employees or UF Health employees, they're all quite similar, and honestly, we would be happy with any. The one that we included in this new Appendix I is the UF Select Humana Vision Plan, which is offered to other UF employees, full-time UF employees. So it's, you know, something that's already being offered to other employees at the university. And again, same thing with when calculating the employee costs. It's about a quarter of what would normally be paid for employee only, and about a half for when it comes to emergency care and hospital services. So when you compare Gator Grad Care to the other Gator Care plans, we have the highest emergency deductible out of any of the plans. All of the other plans have $150 for tier 1 and $250 for tier 2 and tier 3. And our deductibles are $100 more in each of the tiers. So one thing we want is just parity with the other Gator Care plans in terms of the deductibles. And also for hospital services to be covered for tier 3 and a reduced co-insurance for tier 2. And we, I can explain in the next slide how we arrived at the co-insurances for tier 3. So for the proposal for out-of-network coverage, comparing our plan to other Gator Care plans, our current plan is more like Gator Care Prime Plus or Gator Care Options, which is offered to the postdocs. And our proposal is to make our plan more like Gator Care Premium. So the co-insurances and stuff have been determined according to what is in the premium plan, and the deductibles and out-of-pocket maximums are kind of similar in proportion to the Prime Plus or Options plan. We have slightly lower deductibles than what they get for Prime Plus and Options. And again, that's because we are the lowest paid workers on campus. So, you know, we kept that same proportionality when reducing the deductible and out-of-pocket maximums. For the out-of-area plan, which is for the rec employees, we've essentially proposed tier 3 coverage to be at the what our tier 2 prices would be, and also same thing with the co-insurances. You know, we understand that, you know, this is asking for pretty much a different plan and better coverage. So we have proposed a 47% increase to the employee-only contribution to the premium. And so, this, the way we decided that was, looking at, the difference in the employee contribution to the premium for 0.5 FTE employees at UF Health. Basically the increase in price from Prime Plus to premium, since that's essentially the transition that we're trying to make here. So the new employee contribution would be $17.65.
So I'm gonna ask a question real quick. So again, you're calculating 47% increase, not on the actual cost, but just on the employee contribution.
That's right.
Okay.
And that's based on what is offered to other 0.5 FTE employees at the university. And lastly, about cheaper coverage for dependents, similarly, we use the premiums for 0.5 FTE employees at UF Health. And essentially what we have, the way we calculated the new dependent costs was by adding our new proposal for the employee only plus what the difference in cost would be for 0.5 FTE employees on the Prime Plus plan. And I can provide you the citation for that as well. So yeah, that kind of brings us to the end of the presentation, and I'd like you to just walk you through the actual proposal itself. Just in case I missed anything. So yeah, in terms of the first article or provision here, you had initially deleted this part here, which we didn't really understand why. We feel like it's important to know who the provider is, and so we've rejected that deletion in favor of current contract language. But we've kept the rest of your insertions here, and I've just specified Article 12.7 is where you can see the premium structure there. And for 12.2, again, we didn't quite understand what the purpose of this change here was, to basically strike out rebid and add seeks to make substantive changes. So we've also rejected that in favor of current contract language. But we're open to hearing why you have decided to go with that. When it comes to the insurance benefits, a summary of benefits will be provided in the appendix, but also maintained at the website. We agree that it's good to have an updated website, and it's already happening, but it's good to have this in the contract as well. And similarly for dental, as I said, we've put a specific plan, but we're not wedded to any specific plan as long as they satisfy the same criteria. Graduate assistants are not automatically enrolled in this plan, but they can opt in. And again, a summary of benefits would be provided in the appendix and also maintained at the website.
Can I pause you there for one
Sure,
second? So I think that one of the things that we may want to consider, and obviously we have a lot to talk about already, but one of the things I think that are maybe opposing forces as we walk through this is the more specific information that you put in, like a specific plan identified or a specific provider implied, is more likely that we will have to reopen it every year. So I think those two things have to be sort of taken in balance. Like the more specifics that are bargained in, the more likely it would be that we wind up having to reopen it.
Why is that?
Because there could be changes that are done to the plan. There could be, again, because those are plans that are not necessarily designed by us, and I haven't looked at the details on this one, but if they make changes to it, does that make sense?
Do you have an idea of how often those changes happen?
I'll have to look based on what you've got.
Yeah,
I just bring it
we'd
up
like
as
to
a
know
general sort of a point.
Sure.
And that was back to the thing of, I don't know why you put that in here about the provider. So it may be to your benefit, our benefit, if the specifics are maintained, but the provider were to change. Do you really want to bargain? Are you more concerned about the benefits themselves, or are you more concerned about who the provider is?
I mean, are you envisioning a scenario where Gator Care would not be the provider?
I don't know. I don't know. I don't think the name necessarily of the provider is the most important. I'm
Um,
thinking about this long term. That's all.
Yeah, I mean, I would be surprised and, it is in our guidelines that, we should have, the relative, the relevant healthcare representative, so I appreciate, whenever you bring a counter for this, that you have
Okay.
that person here.
All right,
So, those would be the kinds of things we'd like to know about.
Okay. sure.
But I would be surprised if Gator Care was not the provider in the next 3 years, but that, I don't know the internal dynamics there.
Well, just based on the, you guys are projecting and proposing, huge changes to the structure of the plan from my perspective.
Sure, yeah.
So, I have no idea. We're gonna have.
No,
to
yeah,
do a whole-
that's why we would like to have someone who knows about this stuff to sort it out. And like with this, providing the specific plans, like as I said before, like it's just for you guys to have an example of what we're looking for. But, we're not wedded to any specific plan. We just chose these because we know these are already being offered to UF employees. And so, we feel like that it would be easier to also apply that to us. Similarly with the vision, it's the same thing. We added a new appendix. The summary of benefits would be there, plus the website. And it's also opt-in. And we, provided the costs in the same way. For 12.6 and 12.7, we're okay with how you deleted this and rearranged some of the language there. I think it makes more sense the way you've done it. And then we changed the premiums according to what I had written before or presented before. And it would be, for the duration of the 3-year period. For the out of area plan, again, we're happy to have it in the appendix and also maintained on the website. And to address the lack of information that people are getting at these rec units, we are also proposing that people on the out of area plans should be informed through their letter of appointment and also be told that they can access tier 2 coverage at the same price as tier 1. And also that there should be a dedicated Gator Care representative for the out of area plan. Like someone should know that what are the specifics of that plan and also be able to find providers for those graduate assistants who are not in Gainesville, and there's lots of them. So that's how we would like to address those issues.
When you say shall be informed, excuse me, or informed that they're out of area?
Yeah,
Or are they not currently having, they don't currently have information regarding Gator grad care in their letters of appointment?
from the few that I've talked to, they don't seem to have any information.
I think it's dependent on the department whether they provide that information and.
Right now, it's not in our Article 4 that information should be provided. So that is something we would put in our counter for Article 4 as well. But it's not.
Okay, no, I would just wanted to make sure I understood.
I said in accordance with Article 4, with the envisioning that we would put that in our future counter proposal. It's not there right now.
Okay,
Yeah.
I just wasn't sure if you meant that they were out of area or that Gator grad care was an option. So I just thank you for.
Right, so,
Generally speaking.
So we would like to inform people that Gator grad care is an option.
Mhm.
And also, if we're gonna go with this opt-out thing, then just say that, okay, you're already in Gator grad care. If you don't want this, you can opt out. But specifically for the out of area people, they should be notified that, you have an out of area plan, which means you don't have to go to Gainesville to get care.
Okay.
And you can, call this number to, find providers or whatever. Because they all really have pretty horrible stories from that. So
Thank you for clarifying.
sure. In terms of 12.9, I think it makes sense to have this provision in this article. That 9-month employees still get healthcare in the summer. And for 12.10, we wanted to know a little more, is this just, does this differ from what is currently the protocol or is this something that you're already doing? In terms of like, if someone is on unpaid leave, then they would be responsible for their premium, you know, once they get back on payroll. Is that something that's already being done?
So I think it's a clarification of the fact that we can't, like, if someone is taking cover, like if they go on extended unpaid leave,
Then you can't deduct from. their
you
pay.
can't deduct from it. So I think it's purely a function of the new things we're talking about with respect to Article 8.
Okay,
So if we're gonna create this opportunity for people to be separated, which we've talked about all the good reasons why that's important to both the employees and the employer,
right,
it could create a situation during which if someone's gone for an extended period of time, and let's say that they took dependent coverage, regardless of what we agree that the cost is gonna be, if they don't have earnings and there's a premium that they have to be responsible for, there's an obligation on the part of the employee while they're away and separated, that they have to make up that difference with respect to the coverage that goes over and above what they would have otherwise earned.
right,
That's what it's intended to clarify.
okay, okay.
I mean, that's the way it legally has to work.
Yeah, I think
Okay.
that's probably how we do it for.
Yeah.
So, I mean, the
Other
only thing I've
employees,
added
right.
there is, I mean, last time you had made a big distinction about the premium versus the employer contribution versus the employee. So, I mean, I just wanted to clarify, I mean, the way you had written it, it seemed like you were trying to sneak in that we should pay for the entire
Oh, no,
premium,
and
which
I-
I don't think was the.
No, and I think at our last meeting, we talked about the
Yeah,
fact that we
yeah.
needed to change that to the
Yeah,
employee
yeah, so
contribution.
that I
That
added
was
that,
our-
yeah.
Yeah,
We wouldn't be allowed to do that anyway,
Yeah.
because we can't, just because somebody changes their leave status, we don't get to charge them a different amount than they.
No,
agreed to.
I know,
Yeah.
I don't think it
No,
was your.
that was
intention.
not the
Yeah.
intention.
that was our oversight. We
Yeah,
presented
that
it.
was my
Yeah,
mistake.
no problem. So, I just wanted to, show you guys the appendices as well.
Okay.
Oh, and I forgot to hand you the actual.
That's okay.
Here you go.
Thanks.
And, I didn't print out the vision and dental ones more than once, just because,
A lot of paper.
We'll just give all the stuff to
That's-
Patrick.
yeah. Um,
If you could send it electronically too.
I will.
That'd be great.
Absolutely.
And can you send me the presentation as well?
I will,
Yeah.
definitely. I will send you everything. So let me just share on Zoom as well. So appendix F, I mean, I'd already kind of put a screenshot of that in the, what's it called, on the presentation. And again, these are numbers that we've, chosen based on what's there in the premium plan, and also, looking at how our deductibles and out-of-pockets, maximums differ from the other plans, and kind of trying to keep that proportionality there. Again, we're trying to, reduce, have parity with the other Gator Care plans when it comes to the emergency care, and also, really address the hospital services as well. And then same deal here with the out of area plan. Essentially the deductibles, out of pockets, and co-insurance are the same as what our tier 2 would be. And again, just trying to get parity with the emergency care deductible, and trying to ensure that tier 3 is available to the out of area people. Because it's, yeah, a real source of stress for them. And I'll just show you what we had as examples for the the dental and vision plans. Just so you have an idea of what we're talking about. So yeah, we've stricken out the current program in favor of what's available to the state employees, and this is what a prepaid plan looks like. Essentially, like, the reason why we like this is that all of the services have like a specific copay associated with them, and preventative services have no charge for the most part. And so that allows us to budget like much more reasonably than percentages would allow for. So essentially, this is a very long, that's why I didn't print this out, because like literally every type of procedure is listed here. as well as what our contribution would be to that. So that's really the advantage of a prepaid plan, and that's along the lines of what we're looking for. If you look at the Humana Advantage plan that's offered to 0.5 FTE employees in UF Health, it's pretty similar as well. And I'll just briefly share the vision one as well. Yeah, this is what's offered to other UF employees who are on 1 FTE. Yeah, something along these lines is yeah, what we would be looking for. So yeah, that's proposal for health insurance.
I noticed you changed or the terminology domestic partner and remove spouse.
Right, oh, I forgot to, thank you for bringing that up. That's also something that is offered to the Shands employees. We noticed that for their premium schedule, and we felt that that's also reasonable for us to have as well. Yeah, sorry, I didn't mean to sneak that in. I should have mentioned that.
Taking a couple minutes there. Okay, thank you very much for that. If you could email me that stuff.
Absolutely, yeah.
Electronically, you know, obviously, it's very complicated, very technical, and obviously, we have a lot of conversations we have to have with people that are experts in that area.
For sure, and we would love for some of those to be present the next time you bring it.
Absolutely, yeah, and I'll let you know. I can't guarantee it's gonna necessarily be the next time we get together, but at the time that we come and bring it, I'll make sure that we have somebody.
Yeah, that's what I meant, yeah.
Because obviously there's a lot in here to do and
For sure.
a lot of costing analysis that's gonna have to get done.
And we would appreciate how you calculated. those as
Absolutely,
well.
no, I get that, and that's not something, quite frankly, that I could even do, or even the team could do by ourselves, we just can't.
Right, and that's why,
I can handle
Okay.
I got it.
Got it.
I mean, that's why we base our proposals on what we know is out there. At the
Sure.
moment, and being offered to other employees at this.
Sure, I get it, I mean, I may fancy myself relatively good at math, but I'm not an actuary.
And again, I mean, as graduate assistants, we tend to hew on the younger side, and we generally are a low risk pool, compared to most, the general population. So
Yeah,
that's another thing to keep
just
in
one thing that really stuck out to me from the presentation that I just want to ask about, and you may not know, and that's perfectly fine. The percentage of people that had traveled internationally for healthcare, was that controlled for which students were international students prior to? Or was this talking about domestic students that traveled internationally?
I would assume most of them would be international students.
Okay.
They travel back to their home
Yeah,
country.
I mean, because to some extent, to be perfectly honest, it would make sense, especially depending on the country from where they're coming, if they have low to no cost healthcare in their domestic country. It's no matter what the cost is, it's probably gonna be cheaper there,
Right.
depending on their country of origin.
Right, I think what, the thing that we'd be trying to address there is like some of the examples that we gave, like someone living on painkillers for a year.
Yeah, that's,
before they could go
that's,
back,
I
like, that's the
acknowledge
type of
that's
thing,
different.
Yeah. So, if you live like across an ocean, like you can't just like hop over and
I got
get
it.
some care, like it's.
And part of that for people flying back home too is for dental procedures too, because, dental plan that we have now doesn't really cover any of those more expensive procedures besides just the regular cleaning.
I got it.
Also, as a final note, it's not free to travel back to their home country, so they are still paying a cost and choosing to pay that versus their
Yeah,
plan.
I
here, so.
acknowledge that. There's an analysis that would have to be done about this is what it's gonna cost if I stay here versus this is gonna cost if I travel home and then get it done. I acknowledge that. It's a fair point.
Okay, so if you don't mind, we can go on.
Yeah,
to the
go
next-
ahead, please.
Okay, so for our second proposal, this proposal is about graduate housing. It's an entirely new article. And I'll give you the proposal in a second. I just wanted to also contextualize the proposal as well from yeah, some of the results from the bargaining survey, but and I'll also let Derek speak on behalf of this proposal as well. So you know, from the respondents of the survey, about 7.5% lived on campus. The average rent is on-campus housing is about $770 a month. 80% of graduate assistants in on-campus housing are rent burdened, which we're defining as rent is being more than a third of their income. That's typically what a landlord would ask you if you know make more than 3 times the rent. UF's own Schimberg Center for Housing Study defines cost burden as being more than 40% of income. So if you define it that way, 33% of graduate assistants in on-campus housing are paying more than 40% of their income, which is higher than the state average of 30%. The application fees are about $50, and those are paid not to actually make an application to the housing, but just to view the listings themselves. And people are paying about $100 or slightly more than that in utilities in a month.
The bottom two are for off-campus?
No, all of this is for on-campus graduate housing.
Okay.
Yeah.
So there's a $50 application fee to view on-campus housing?
Yeah.
Okay, and then $100 in utilities. Okay.
Yeah, that's right. All of these facts are about on-campus graduate.
Okay,
housing. Yeah.
sorry, thank you for clarifying.
So our priorities for this proposal, one is to establish that graduate housing is a mandatory subject of bargaining. I'll explain a little more about that in the next slide. And also to get some benefits for GAs who are living in graduate housing. One would be the waiver of the application fees. Another would be credit for utility payments. And also ensuring that graduate assistants are not rent burdened in graduate housing on their graduate stipend. And lastly, to establish some renters' rights that are just basic things that are in contradiction to the rules that are arbitrarily applied to them. So we also want to ensure that in light of these benefits, that graduate assistants are not being discriminated against just because they receive these benefits. We also want to ensure that there is a graduate representative on the campus student housing committee, which is actually part of the committee's own rules, but for most of the semester that was not being followed, and Derek will speak to that a little more as well. And also, if there are major changes being proposed to graduate housing, that would try to trigger a consultation with the president, as we proposed with Article 3 as well. So according to PERC's scope of bargaining guide, housing on worksite location is a mandatory subject of bargaining. So graduate assistants work on campus, which makes campus their worksite, and on-campus graduate housing is worksite housing for GAs. So therefore, graduate housing is a mandatory subject of bargaining, and which means that at the very least, you are obligated to bargain with us in good faith about this topic. So in terms of the actual proposed benefits, one of them is to waive the application fees that are paid just to view the listing. Another would be payment of utilities for worksite housing, which has also been established by PERC to be a term and condition of employment, i.e. also mandatory subject to bargaining. Yeah, we would like to ensure that GAs are not rent burdened, that they're not paying more than rent, rent. And also renters' rights, which are essentially exemptions from the arbitrary community standards and rental terms and conditions which are applied to them. So they don't really sign a lease when they are in graduate housing. It's more like these rules are applied to them and no one, they have no say in what those rules are. We also have some additional provisions. So to ensure that there's no discrimination against GAs, because of the benefits that they receive. We would like to get a report with the following information. One is the number of rejected, waitlisted, and accepted application broken down by GA status. Another would be the number of occupied and unoccupied units in each semester, and the reason for unoccupied units and the unit numbers as well. It's been noted by a lot of people who live in graduate housing currently that there are lots of unoccupied units. And it's also been noted by a lot of people who are on the wait list, that they cannot actually get off the wait list, even though there's unoccupied units. So we would also like to know about the distribution of time that's spent on wait lists by different people. Because I know some people who have been on the wait list for a very short amount of time. I also know people who have been on the wait list for more than a year. So that's also some more information that we would like to know about. Again, yeah, if there are major changes to the graduate housing that are being proposed, that would trigger a consultation with the university president, per our proposal for Article 3 as well. And lastly, that the campus student housing committee must have a graduate representative and should meet regularly, which they haven't been doing. So with that, I will let Derek speak a little bit. This is Derek. He is the president of the Mayor's Council, which is a representative body for graduate housing on campus. And he's very involved with all issues related to graduate housing. So I couldn't think of a better person to speak on behalf of this proposal.
You sit in the mayor's council, is that what you said?
Yeah.
Okay, thank you.
And he can introduce himself a little more.
Thank you. So as he said, my name is Derek Lamontagne. I am the president of Mayor's Council. It's an organization decades old that represents graduate students living in on-campus graduate housing. Specifically, we currently represent the Corey Village, Diamond Village, Tanglewood Village. We used to also represent McGuire and UVS, but those have been taken offline recently. And I actually was one of those people who was forced to move from McGuire Village to one of the other villages just this year as they were closed for not great reasons. But I hope to kind of focus on ways to move forward and what options students can have in the future, because this matters a lot to a lot of students, especially international students. Over 70% of the people living in on-campus graduate housing are international students. For full disclosure, I am from Florida, but I try to do my best to speak on their behalf because a lot of them are kind of, worried about, their status and so forth. And, there's reason to be worried because some of the people in charge of housing really haven't treated us well in recent years. Specifically started during COVID when some of our housing was sort of taken offline just to house undergrads without our knowledge, without our permission. That did happen. And yeah, people were very worried, and even our representatives reached out. We weren't really informed about that. So it was really a painful time at that time. But overall, the benefit in good times, or I'd say, we're hoping to get back to kind of steady, happy times because graduate housing, especially this on-campus option, makes graduate students more productive, makes them happier, and the community itself builds those connections that helps with various things like research papers and just other collaborations that really help the university succeed in its missions of research and teaching and all those things that grad students provide. So and additionally, what the housing actually is, it is so critical in actually getting students here in the first place. I've heard time and time again that students, and this is not just international students, domestic students too. I've heard people from the West Coast say, hey, I could only come here because you guys offered a good housing option. I had nowhere else to go. And then for international students, a lot of times they don't have driver's licenses. They don't have social security cards right off the bat. So they are basically needing to use the UF housing or the campus housing to make their selection to come to UF in the first place. So yeah, this is attracting people when it's working right. And I just want to say that what UF has now in terms of actual physical infrastructure, if we utilize what we have, it can do a good for, lots of students. Although, like I said, with the taking offline of a couple recently, we've gone backwards, but I'm hoping that in the future, we can get more options moving forward. And as Sikander was saying, one way to do that is to keep the costs low. And an easy fix right off the bat is to kind of like allow roommates that they don't allow right now. Currently, the people in charge of housing don't allow roommates, even for these doubles. You have a 2-bedroom apartment and you can't have a roommate unless you're married, basically. And so even if 2 grad students want to live together and cut that rent in half, which would, you know, put them under that limit that he was saying was so important for when you have low income, like that seemed like a no-brainer, but housing has refused to do that. And when we've tried to say like, well, what do we need to do to change that policy? There's no mechanism. There's literally no oversight to housing. And we've tried through that campus student housing committee, there's supposed to be at least this committee called the Campus Student Housing Committee, similar to like the Parking Enforcement Committee and, you know, Landscaping Committee. There's a committee that actually is called Campus Student Housing Committee. And this year, it met exactly one time in January of this year, 10 months ago. I was at that meeting, and I spoke and requested that, I said, can you guys please meet more often? And they said, yeah, we'll try to meet like, you know, monthly or at least a few times a semester. And yeah, they haven't met since January. And that was really a letdown. And I think it is partially because, again, housing is kind of, and this is something for you, please look this up in your free time, or maybe you already know, kind of housing considers itself to be independent in a sense, because they're sometimes calling themselves what's an auxiliary, right, as you know, but yet I think they kind of have it both ways, and they kind of use it as an excuse more than anything, because I'm not 100% sure, I'm not trying to like get you to investigate them or anything, but basically, yeah, if they're independent, then really we're at their mercy in a sense. And but if you guys as a university are like really in charge of them and say like, hey, you know, don't tell them, you know, they can't have all these, you know, strict rules. We also can't have pets and things like that, which, you know, is bad for our mental health in some sense when people want to have that. But and those fees hurt us too. So they're charging these fees because they're like, hey, well, we need to like, you know, make money or something because we have to pay for our own revenue, basically. I think that's how they word it sometimes as an auxiliary. They're like, we have to be independent, but it doesn't have to be this way. And of course, there's other things that like, well, why does that cost anything to anybody? But anyway, the benefits of housing are clear that, you know, if you live on campus, you're close to campus, you'll be able to work easier, more quicker, and show up on time to all the things you need to go to. And then, you know, it's that saving time, saving money, and when we're sort of not treated very well by the people in charge, it's troublesome. So we just want a mechanism. That's what I've been asking for years, is a mechanism to have that oversight. And as you mentioned, that Campus Student Housing Committee, in the past, it did say the president of Mayor's Council, which is me, is supposed to sit on that committee. They somehow, without having a public meeting, arbitrarily removed that language from the bylaws, basically, of that committee. And now it doesn't say that, it just deleted like that part. And so they did not seat me to that committee, which I was supposed to sit on, and I could have maybe even argued. So they only allowed me as a guest in January when I was, my predecessor, like a year or two before this, was actually on that committee, but they just changed this in 2022. So there's a lot of things that are happening that basically has no oversight. And, but yeah, getting back to what we could do here today. So getting a seat on that committee, getting the committee to meet more would be a step forward, and getting that information. So as Anna mentioned, we just really want to know information on like how many units are unoccupied, which I can tell you, you know, if you include McGuire UVS, it's over 300 easily because they're all empty. But even for the other ones, yeah, you can see a lot empty, and maybe they're just slowing their turnover because they're like, well, we don't have a maintenance person to like, you know, paint it or whatever they need to do. It's like, well, you know, how long are you going to wait to hire that? Like, you know, it shouldn't be us pushing that. It should be kind of automatic. And it's just, you know, people, from what I know, and the committee has at least released this one piece of information, that the wait list is usually around 900 people. And those are people who paid the application fee. That's not people who like just still would love to live on graduate housing, which actually a lot of people would. So we're talking 900 graduate students right now would like to live in on-campus housing. We just don't have enough inventory. But again, just to back up to say what the physical places we have, a lot of them are like great. There's lots of trees. It's good for families. People like that. They don't so much like the, you know, high rises and other things that are being put up for undergrads and you know, recent years and off campus, which are also much, you know, more expensive in general. So keeping these rents affordable is important. But yeah, just even for the off-campus places, they have these additional rights, which we don't have. They do kind of throw at us all these rules and responsibilities. And those include, yeah, you can't do any, business on your own. You can't, set up your own little, washing machine. You can't have a, radio antenna, even though those are like federally against the law, but in other things, yeah, they take away our pool access and things without like notifying us. So we need that oversight, and we should have, yeah, a list of our rights too. And that currently doesn't exist, and even if we just had like the same deal as the fraternities and sororities, who are also kind of, pseudo on campus, that would be great. If we could somehow have the graduate students have that seat either on a council or just be given that independence. Like, I almost want to say, like, why can't we just switch where the graduate housing is now to be run by, graduate students? I mean, I don't know if that sounds unreasonable, but I mean, fraternities are run kind of by their own company that does that. We could maybe do the same. But anyway, I have lots of ideas on that. I'd be happy to talk more about that some other time. I'm kind of probably at the end of my time here. So just want to say that, yeah, we really want to have some mechanism moving forward to fix problems. And I believe that the GAU can help, negotiate that with you guys, and just, I'll let you know if there's issues we're facing. We can make it great. We can attract more people. We can make it a really great place to live and, attract that talent for future, production at the university. So thank you for your time, and, yeah, I'll do that.
Appreciate it, Derek. Thank you, for making that statement.
Derek, could you spell your last name for me?
LA_MONTAGNE.
Thank you.
Okay, so just to go through the actual proposal itself, 27.1 is essentially asking for that report of the number of people who are rejected, waitlisted, accepted, broken down by GA status. Again, this issue with the unoccupied units is something also we would like to find out more about, both the number of occupied and unoccupied units, as well as the reasons why they're unoccupied. And lastly, as I said, the distribution of time that's spent on the wait list, because it seems to be very, it varies a lot from individual to individual. For the purposes of this article, the graduate housing that we're referring to refers to on-campus locations that are owned by UF. So those are the ones that Derek is in charge of, Corey, Diamond, and Tanglewood. Those are, yeah, on campus and owned by the university. So one of the benefits that we would like to propose, and I guess I messed up the numbering here, 27.3, it should be, is a waiver of the application fees. As we said, it's totally unreasonable to have to pay a fee without even actually submitting an application just to view the listings. Again, a utility subsidy is something that we're proposing, and has also been established as a term and condition of employment for worksite housing. So yeah, we're proposing a $25 monthly credit. People pay about $110 in general. The last benefit, or kind of major kind of monetary benefit, would be rent burden relief. So graduate assistants living in graduate housing are responsible for their rent up to a third of their income, and then the remainder would be covered by the university. And in terms of the renters' rights, essentially, Derek had talked about some of these, and maybe talked to some of the specific instances of these things happening. But essentially, graduate assistants living in graduate housing will have the following rights, and will be exempted from the housing and residence life community standards and housing agreement terms and conditions to the extent that they conflict with these rights. And again, these are terms and conditions and standards that are imposed on them, and they have no
I
say.
feel they were written a lot for like the undergrads too. They kind of copy and paste it when they can't use it for us, and it's like, a lot of them are, yeah, it doesn't make sense for people who are, graduate students and some families and some just, living in other ways.
Right. So one of them is the right to have a roommate who are not spouse or children. The other would be the right to remain in a housing unit until the end of the lease term, even if the main person on the lease graduates. So there have been instances where the main person on the lease graduated, but the other person who has not graduated has also been kicked out. So yeah, we would like to end that practice. Then the right to remain in a housing unit until the end of the lease term or up to 6 months if a GA graduates and receives a postdoctoral position at the university. So that's also something that has happened before, that someone has been kicked out and they're actually remaining at UF, but we're not given enough time to really find a new place. Then also the right to have pets that are not beyond just the service animals and university approved assistance animals that are allowed in community centers, especially cats and dogs. And lastly, the right to elect a representative on the committee that decides the community standards, because these are rules that, you know, that these people have to live by, but they don't actually have any say in determining them. And then lastly, these last two provisions are about changes to the graduate housing. So if the university is proposing to shut down graduate housing units, GAU will be notified in advance, and we may request a consultation with the president for Article 3. And for the 27.8, this is about the campus student housing committee, ensuring that there's always a graduate representative, which again is like part of their rules. It's like not something that we should have to say in the contract, but we want it in the contract since it's not being done. And also that the committee will meet regularly and discuss any changes to graduate housing before they occur.
Have you looked to see what impact on the graduate student for tax purposes, if any, they were for 27.5?
I have not. What do you think the tax implications with that would be?
I don't have a very clear sense of it, but I believe that there's some sort of allowance or housing relief provided to an employee that becomes considered taxable income, that the employee would be responsible for paying a tax on that.
Okay.
I don't know for sure, but that's.
Well, I mean, if you can provide us with more information about that, we'd like to know about that for sure. I did not consider that. Yeah, I did not consider that.
Sikander, can I ask, did you, were there any other, universities or other agreements that you looked at to draw any of this from that we could also kind of look at, other examples perhaps?
No, not really.
Okay.
Yeah.
I don't know if it's possible, but in the specific, the last point on the thing, if possible to have the graduate student representative actually live in the housing, that would be beneficial too, if that.
Sure.
Is that?
Yeah, actually, yeah, that's true. So the current graduate representative is not living in.
Yeah.
housing.
Have said, well, we'll just have someone else and then actually.
We can put that in our next report, but yeah.
But we're talking about just GAs, so not graduate students.
Uh,
Graduate assistants, not students.
yes. We're talking about graduate assistants. Yes, right.
So the representative would be a graduate assistant.
They
Is that
don't
what you mean?
have
Okay.
to be. I mean, honestly, this provision is more to ensure that the student housing committee follows its own rules. If they are a graduate assistant, we're happy with that, but yeah, it's that doesn't necessarily have to be a graduate assistant. Like, it doesn't have to be a GAU person.
Yeah, I wasn't.
All right, other questions from our team? Obviously, we're gonna have to have some significant conversation on that one as well.
And if you could, yeah, bring like a housing person as well, whenever you bring a counter for that, that would be.
We'll talk about that.
Yeah.
We'll talk about that.
So yeah, those were our proposals. I believe you have a bunch for us as well.
We do, there, I think
Can you send them electronically? So
I
that
will.
can throw
I
them?
will, I don't know if we're gonna be able to get through all of them, because, rather than caucusing right now, I'd rather sort of get through what I wanted to get through, but if it would be possible to reserve maybe 20 minutes at the end for us to caucus, would that be okay? Secure,
Yeah,
or
that's
not?
totally fine,
Okay.
yeah.
Rather than breaking and coming back, I'd rather just say if we could be done a little bit early so that we would have time to go have. a
That works
conversation.
for us, yeah, totally.
So. Just based on what I think we're gonna get through, we'll do 16, 23, and 24. Cause I don't even know if we'll get through that, but maybe we can. Let me send it to you. Well, let's go ahead. 23 and 24 kind of go together. Let's do 16 first. Let me know when they come. They're in the ether.
You sent it.
Yeah.
Okay.
I have 8, so. We can maybe share. What?
Oh, no, we're arguing about who's there.
Okay, fair
Who
enough.
won?
Okay.
We both won.
All right, so with respect to this, did you get it yet?
Not yet, but you can, I'm sure it'll arrive in.
Okay, so with regard to 16, not many changes. With respect to 16.4, and I apologize for this not being in color, by the way.
I just know something to probably say.
Oh, yeah, you're right.
Make that.
So we probably need to, and what Olivia just pointed out is that everywhere else in the document, I think we refer to you as UFF-GAU. So we probably need to fix that in the title.
GAU.
It just says GAU, it should say the combination.
Oh, I see.
So that,
Okay.
but that, I mean, that's well, we can fix that.
Okay.
With regard to 16.4, we acknowledge that it's, if you want to standardize, we're okay with standardizing the appointment to a 0.5. But the university is not interested in going all the way up to 6.5. We're willing to round it up to 4.5, which would give you 9 releases at the 0.5 rate per year, but we're not interested in going up beyond that at this time. The language about standardizing that release to 0.5, that language we found okay. And then at the end of with respect to 16.6 and 16.7, the notification, the office locations, that's something we're willing to sort of share with you all to the extent that we can get it. Now, I will say this is something that we're also working on with UFF. It is, I may be saying it wrong, it's multiple different databases that sort of capture that information. And it has been a little bit of a challenge, but it is something that we're working on. So, to the extent that we can get that to you, I don't think that's something that we wouldn't be able to do. Then, especially as people move around. So it's dependent upon the individual units and departments communicating those assignments to a central database. And then with respect to 16.7, providing a list of all graduate student orientations to UFF GAU 3 weeks prior to the start of the fall semester as soon as practicable. So that we're willing to try to do that for you. We do realize, and we just want to state that they're not necessarily centrally facilitated. So it may take some time, even if we agree to do that, to make sure that we get all of them to you in a timely fashion, because it's going to require talking to, significant numbers of individual groups that are used to sort of operating independently,
Right.
who wouldn't necessarily be communicating, even in some respects. And I don't know if Judy or Tom want to speak to this. They don't even necessarily communicate with the grad school when they're when their orientations are gonna be, because they're used to sort of doing them on their own.
Right, my experience is we were actually waiting for the grad school to tell us when their main one would be, so we could figure out when ours was. So
Right.
It would be kind of a chicken and egg thing,
Right.
but this seems.
Yeah, I mean, it's something that we're willing to sort of work on.
No, I understand, that I was actually part of the welcoming committee for biology, and like, I wasn't notified about the orientation until a couple days before, so I know.
And
that-
you were part of it.
Yeah, I was part of it, so I know that the departments often, do these things last minute, but it would be good to kind of maybe have a practice in
Right.
place to start reporting these to a central location. just
Well,
so-
and if it's.
And also, like, I was really pissed off at our director of graduate studies, because like, you should have told us this before, man, like, these things should not be done so last minute, so. yeah.
Well, and if it's in here, like I said, it may take some time to get off the ground if we wind up agreeing to it, but if they know in advance from us that this is information we're gonna be requesting, it may sort of encourage them to maybe think about it earlier. I mean, I don't know that, but I mean, I would hope that, at least over time, it should lead to more transparency in planning, and it doesn't mean that changes wouldn't necessarily occur, and it may not mean that we would get all of them, but I don't think it's not an unreasonable thing to try to give you guys the information in a time, so that at least you're aware of them all, so. So that's 16.
You guys have any questions here?
Did you get the email yet?
Yeah,
Okay.
so I mean, that's how I'm showing it right
Okay,
now.
oh, got it. Okay, I wasn't even looking up there. Okay, so the next one is 23. This is gonna get, these are more technical, obviously. These last ones are a little more technical, so we understand if you all have questions or want to kind of talk through how we arrived at what we came up with. And again, I apologize for not being in color.
Thank you.
Sorry, there's the old one. We
Oh,
had like
that's the
3
other
sitting here.
Yeah, you want to hand those down. You haven't. Okay, so I'm actually gonna pull this up on my computer so I can see it in color.
I can also pull it up on the screen, if that works for you. You can see the color over there.
Oh, great. Okay, yeah, fantastic. So, so one of the things that, and I don't mean this to be confusing, but in order so I could show the changes, it's a little weird because what I had to do is copy and paste it in twice to show you that our recommendation was to replace the current contract language. So like that blue phrase, my understanding and looking at the previous languages, it's showing up as new language, even though such subject matter may or may not have been within the knowledge or contemplation. We're not actually proposing that as new language. What we're attempting to propose and show to you is we're proposing keeping the language that was there. So I know it shows up as new, but
Right.
that's not actually
That's current contract.
correct. So it looks like it's a new provision, but I just wanted to show clearly that we're recommending to, because when I took out your strike, the color disappeared. So I just
Yeah,
wanted to
okay,
make it
that's
clear.
fine, yeah.
So yeah, we are interested in keeping that part those parts of the language. As well as, the part that we were, more willing to talk about was the sort of that last part there where it says notwithstanding these limitations, if the university seeks to, and we've said, make a direct and substantial change to a term or condition of employment for grad assistance, the university shall be obligated to bargain the impact of such change upon your request. So I don't necessarily think that makes a substantive difference in terms of the way we wrote it, but we're happy to talk about that in more detail if you would like. Things that it shouldn't be anything that, again, doesn't have any appreciable effect. It needs to be something that is substantive enough to be worthy of conversation. And we're obligated, by the way, at least our interpretation, we're okay with the language, but we feel we're obligated to do this anyway. When you know what, this isn't the version that has the reference in it. I need to give it to you again with the reference in it. There's a legal reference that I had a note on here. You may actually see the comment. Oh no, you can't, it's hidden. I need to include a reference. I'll get that to you today,
Okay.
an updated version.
So, I mean, what is the purpose of this language? Whether or not referred to in the agreement, even though such subject matter may or may not have been within the knowledge or contemplation of parties?
It's more comprehensive. In other words, it means just because something we didn't think about, that doesn't mean that it then becomes we then would have to bargain it substantively.
Hmm. So why is this language not in the faculty contract?
I don't know.
Okay.
Well, I wasn't there when it was bargained.
That's fine. In terms of like makes a direct and substantial change, I mean, shouldn't any change to a term and condition of employment? You should be obligated to bargain for whether it's substantial is a very subjective term, right? I mean, any change to the term or condition of employment should be bargained.
Well, I think what we're attempting to do is not have to engage in this every time there's something that's fundamentally trivial that really has no appreciable impact or change.
Like, could you give an example?
Hmm.
I mean, term or condition of employment, I think would inherently imply
Are you talking about maybe like something where like a name gets changed for like something and it becomes outdated in the contract? Are you talking about like trivial like that? Like
I think in other words, and again, keep in mind, I'm not an attorney, so I may be using the wrong terminology, but what I'm saying is if it's something that's different, but doesn't actually have any appreciable impact on your relationship with us as an employer or affect your ability to access any of the benefits to which you would otherwise be entitled.
But then it wouldn't be a term or condition of employment, right?
Right, but that's what I'm saying. We don't want to have to engage in that argument about you would have to be able to articulate, look, this actually affects my work. It's not just something that's different. It actually affects my relationship with the university.
Right, but a change to a term and condition of employment would imply what you just said, right? I mean,
Correct.
yeah, so, but a substantial change, that then you starts to induce some kind of like, well, this one's substantial, but that one's not substantial, right?
Right.
So, I just don't see, if you can't provide us an example of that, I don't see why that language needs to be in there. Can you guys think of it?
like the only thing I could really think of is like something like with some type of naming or something and like
But
maybe.
that's not a term or condition of employment.
But it would change, under that, would it change the contract, like would the contract need to be updated? Is that like where you're worried? Like,
Yeah, it's kind of like, it's not. I don't know, we don't have to, it's kind of like
Yeah.
trying to prove the negative is, it's more
Yeah,
like just kind of
this-
making sure that it's. To me, that those are kind of like. Terms of conditions of employment are almost like the things that are in the agreement, so if
It's so if anything changes in the agreement. then-
that's what we're
Right.
saying is, we don't even necessarily think this language needs to be in here, because we're already legally obligated to do that.
Right.
But we're happy to put it in and kind of restate what the law is essentially, but, just so it's clear that impact for people maybe who don't know the law, that impact bargaining is part of this. I don't see that.
I have a question. I have one maybe a little bit separate, is the cross out of the word seeks to, which you said is minor, but I feel like it changes the timing of a lot of this. It turns it from
Mhm.
something where if instead of you're seeking to make a change, we would impact the effects of that change, which I think could be very negative depending on what
Yeah.
the substantial
pretty
change
substantial
is to our
change.
graduate assistants.
Right. But I think that goes to what impact bargain is. See, impact bargain, if it's something that, say, for example, that we're legally obligated to do, our requirement to impact bargain with you does not actually prevent us from making the change if we're legally obligated to do it. We have to bargain the impact, not the actual change itself. And I think that's an important distinction between substantive bargaining and impact bargaining. And we also realize that that's also central to many of the current ongoing court cases between you and your parent union and some of the universities across the state. But it is something that we pretty firmly believe that if we're obligated to do something or to stop doing something by, a righteous constitutional authority, then we're going to go ahead and make that effort to comply.
Mhm.
We will, dutifully engage in impact bargaining with you all, but we don't want there to be any question with respect to your question about whether or not we have to seek your permission before we do something that we consider to be lawful.
But this isn't specifically for things that are legal or not. This is an all-encompassing thing. This doesn't reference if you're obligated by law.
Right.
So this is,
But then you could file a ULP. So if we did it, and you could file a ULP anyway,
Mhm.
unfair labor practice. So if we did change a term and condition of employment that you felt was inappropriate, you could file a grievance, you could file a ULP. Those are all things that are part and parcel to the relationship between the employee and the employer. This doesn't disallow you to do any of that. It doesn't violate, it doesn't take away any of those obligations.
Yeah, I mean, I think, yeah, if you could send us that link, with the law.
Okay,
Yeah,
sure.
I think that would clarify things a little bit.
It may actually be a group of them, but yeah, we'll
Yeah,
get it to you.
I think, the word that's getting me to is substantial. I think direct is pretty clear, a direct change to a term and condition, but I think substantial has a bit of ambiguity that, like,
For
going back
sure, yeah.
to what Sikander was saying, like, what is substantial if it's a change to a term and condition? A direct term and condition is clear, right? It's something that's laid out in the contract, but substantial, like, we're getting back into ambiguity there. I think instead of clarifying, it's leaving more room.
Yeah,
Okay.
make a direct change, yeah.
A direct change, I
Yeah.
think, is,
Yeah.
suffices.
Yeah,
All right, we'll take that as feedback and go back and have a conversation about it.
Mhm.
All right, and then.
Wait, hold on. Any other questions, Jacob?
no, I'm good.
Yeah.
All right. And then 24, which is somewhat related, especially with respect to 24.2, but talks a little bit, Austin, about what you were just talking about.
Right.
Um,
Thank you.
All right, so Article 24, which is severability. What we have at the end of 24.1 is regardless of whether the subsequently enacted legislation is the subject of a lawsuit challenging its enforceability. So one of the things that what we're not interested in doing, again, sort of much to my point before, is, just because a lawsuit is pending, we don't feel that the employer's responsibility to comply with something that we feel is dutifully lawful. We don't want to be hampered in our ability to comply with the law. And just simply filing a lawsuit does not automatically assume that the law is going to be overturned or enjoined or anything like that. And then with respect to 24.2, what we have is if any provision of this agreement is rendered invalid by subsequently enacted legislation, the university agrees to engage in collective bargaining with UFFJU regarding the provision with the intent of preserving the language to the extent it is permitted. So we understand kind of what you're after with that, and I'll talk about the first part that we crossed out in a second. But so basically what we felt like you were interested in doing is saying, look, we have, if something is struck out legally, if we believe it's rendered invalid, we feel like, and correct us if we're wrong, that the university should be trying to approximate as closely as possible to the language we had before to stay legal. In other words, complying as closely as possible to what the intent and the stated language was, even though it has to be bargained. You don't, and again, I'm putting words in your mouth, so understand I'm saying from your perspective, just because we have to rebargain, it doesn't mean you're going to substantively bargain and change the whole provision and take other things away from us that are still legally available. And I think we get that. We understand that part. The part that we feel is just confusing and unnecessary is if any provision of this agreement, which is that I'm reading that what we're suggesting to strike out, any provision of this agreement which is contrary to law but becomes legal during the term of this agreement shall take immediate effect upon the enactment of such legislation.
That's current contract.
It is
Right,
current
yeah.
contract language. And we realize, by the way, that it's also in many different contracts. We believe it's confusing and unnecessary, and let me explain to you why. That would require us to be constantly actually having a contract and ratifying a contract that isn't currently legal or lawful. And we're not interested in allowing continuously ratifying and considering provisions which we know at the time we agree to them aren't legal. So, and again,
I think that line there is to address something like what we're facing now with the dues deduction thing. It's like,
100%. That's a great example.
Yeah.
Go ahead.
Oh, no, I was gonna say, like, we kind of use the dues deduction experience as a
Right.
way to try to
Right.
clarify this language.
sure,
Because we think kind of like, if you just following that language in the first sentence, then that kind of means that,
either it was
You're
illegal when
leaving-
you put it in.
well,
or
it's still illegal and then, but I think it's confusing to people who maybe aren't sitting at this table or that they, you have a new GA who comes and they look at the agreement As we all know, they're reading their
Yeah,
CBA.
sure, yeah.
But they look at that language and they see, oh, we have dues deduction language.
Mhm.
Like we have dues deductions because it's just sitting there waiting to, even though it's legal. And I think what we ended up agreeing to, collectively is, when we impact bargain that, we were able to put that language in there, that kind of sentence in that article that says, this is not legal right now, but it'll revert back,
Right.
and I
Right.
think that's more helpful to everybody who's reviewing the contract.
Right.
So kind of that second, so like the language we're adding is kind of envisioning
Right.
But you
another
removed the
scenario.
part which would allow it to revert back.
No, I think that's kind of what we're saying here is we can impact, or we can kind of almost do what we did for dues
Mhm.
deduction. We can bargain. We could even just bargain to put in a sentence like we did in the dues deductions article.
Right,
So we're bargaining it and the intent is that it reverts back if
Right.
it becomes legally
Right.
valid. But I just think it's more clear to everybody who's looking at the contract that it's not legal right now, just because we're able to bargain and put that clarifying language in there, that it's not legal right now, but it might become legal later. I just think it's confusing to have a contract that has a legal law, unless you know what the
Right.
law is.
Right.
It's-
And I think the intent was not that we would bargain and then agree to terms that are not legal at the time that it happened. It's more so to protect what's already in there.
Sure.
Because like, again, with the whole dues deduction, there was an injunction that kept getting pushed back and happening, but if that injunction went through, then, what we want the dues deduction, the contract to immediately go into effect. We didn't want to have to like re-bargain it or anything like
Right.
that.
And I think, again, to that example, which is a good one, because
Yeah.
it's timely, one of the first provisions we agreed to in that sort of addressed exactly what you're describing.
Right.
Which is, okay, look, we acknowledge collectively that this is no longer legal, at least as it stands.
Mhm.
But if something changes as it's working its way through and it becomes legal again, or it's struck down or whatever, then we can go ahead and sort of
Right,
return.
Okay.
Yeah, it just seems to make more sense to put it in the individual article
Right.
than,
So instead of
To have
having
it.
like this overarching one, when the time comes, we'll just add it in when needed.
yeah, I just think it makes it clear for everybody who's reviewing the agreement that that's what the situation is. And then sometimes there might just be like, to that last sentence, there might just be like one specific thing that becomes,
Right.
valid, and then we
Right.
would just like strike out that one portion or whatever, and then it would revert back.
Right.
but I
Trying to
feel like
maintain-
striking out the original line, which allows for a term that becomes legal during the term of the agreement to take immediate effect. That if by removing that, and you just have what's in red. I don't think that alone implies that when we do impact bargaining, then like we wouldn't change other things, like the way that it, like, if we were to just like, remove all the deletions and stuff.
Yeah, I get that, Sikander. I
Yeah.
think what it comes down to is whether or not we can agree on the phrase rendered invalid.
Uh-huh.
And I acknowledge that we probably have different interpretations of that, also based on the weight that we would give the contracts clause, which is also relevant, some of the things that are coming up.
Right,
I think that we're gonna take a pretty strong position that if we have a constitutional authority that directs us to take some sort of legal action, we have an obligation to comply. We acknowledge that there may be times when you don't agree with that and you feel that the contract is more weighty than, whether it be a bog regulation or a BOT, regulation or even a state law or federal law. I acknowledge that. I think the university's position is that we will always have an obligation to impact bargain those things with you. But we're not gonna delay legal compliance to satisfy that collectively bargained obligation. We're gonna bargain the impact of that, and then we're gonna take what we believe is the necessary action to be legally compliant.
so can I ask why you removed the last provision there?
Sure. It's very, very similar.
Yeah,
We don't wanna get into arguing about the constitutionality of any of the organizations that are, again, constitutionally above us. We don't feel that we have to bargain the constitutionality of the BOC.
no, well, it's just saying that we don't see to the constitutionality of any subsequently enacted legislation.
Right.
We're not saying that like, and we're not saying anything about the BOG.
Right.
Yeah,
And you're permitted to challenge it in court.
right,
By this being in here, our interpretation is that we are acknowledging that you have the right to dispute the constitutionality of one of those groups.
right,
We don't believe you can make that argument in court or through a ULP or for whatever you want.
Right,
We don't want to acknowledge your right to make those constitutional challenges on a comprehensive basis.
but I mean, this provision acknowledges both parties' rights to challenge the constitutionality of subsequent reenacted legislation.
Right.
So it's not like a one-way thing, right? It's like,
Right.
it's to allow both sides to be able to essentially say that, like, hey, we don't actually agree with the constitutionality of this, and like, we plan on fighting this in
Right.
court.
And
And
those
that's what
rights
the
are
rest
inherent.
of the provisions are also. supposed
Right,
to
but those rights are inherent. Your ability to challenge the constitutionality of something exists whether or not we have it in the contract. I mean, that's the way it's all structured and set up.
Right,
We don't need to collectively bargain whether or not you have the right to challenge the constitutionality of a law, just like we don't have to get your permission for us to do it if we want to do.
right.
We don't believe we should have to have a contract argument about whether or not you have a right to constitutionally challenge something.
I
Similarly,
mean, there are many provisions in this agreement where we acknowledge things that are, a law or a regulation or something like that. That are independent of bargaining, are not things that are actually determined at the bargaining table, but
Right.
are the things that we acknowledge just, for
It's-
the sake of it.
I acknowledge
And
that.
I think that this is one of those things.
So squaring 24-2 and the old 24-3 is the problem with us, because they
Okay.
seem to directly conflict.
Okay.
And again, it comes down to how you define render invalid. Like,
Mhm.
how do we square those two provisions? Because on the one hand, we don't define rendered invalid, but we acknowledge sort of on a comprehensive way that there are ways for provisions to become rendered invalid.
Right,
But then we go on to say, but we're not gonna see that anybody has the authority to render anything invalid. Like we struggle with those two things.
okay.
So we just ask that you take it under consideration and have a good chat about it.
Sounds good. Any other questions here?
I think going back to your last point,
Mhm.
going back to the 24.2, and what you were saying, I think maybe instead of striking out the entire, section, it might be important for us to clarify that instead of an overarching statement, that we have the right to include these sort of statements throughout the document, right? Because that's what you were saying, essentially, that like, we could specify this more clearly throughout the contract as opposed to having an overarching statement. And I think it might be important here to state that such statements can be made throughout the contract, if that makes sense.
Yeah, I mean, and I'll just say that, like, the way we made this proposal for 24.2 was that, I mean, a lot of this language is directly pulled from the agreement that
We
we
acknowledge-
reached on Article
We
17.
acknowledge
Right,
that.
yeah.
So it's to prevent having to impact bargain. It's like, this is kind of a blanket thing that for all of those, is like, that. As long as it's being challenged in the courts, that we should wait, and that, there is like a blanket kind of, thing on all of the articles that like, until then, yes, like we acknowledge that it's invalid, but it's being challenged in the court, and if it does get overturned, then we would want that to be, or if there's subsequent legislation that makes it legal again, then we would want that to go into immediate effect, rather than having to impact bargain it to add that line like individually for any article. Just have that in there to begin with.
Yeah, I just think the part that's confusing, that I think is, 24.1 is
Mhm.
compelling us to impact bargain if something's rendered invalid. And then if we have that language in there in 24.2, it's essentially saying,
Like an exception.
yeah, so, but it's so broad. It's like, then why do we have 24.1?
Well, once,
if
well,
we-
I mean,
so-
the point, that was the point that also, that you pressed out here, was that once that it's been upheld through final adjudication by the highest tribunal, then, yeah, then it's fully invalid. There's no other way to get around that. So in that case, then we would, impact bargaining.
But
Yeah.
while it's in the courts or whatever, impact bargaining for that, while it's still being challenged, and then if it does get overturned, then we'll have to impact bargaining again to remove the line and whatever, so it's just kind of eliminating all those, like eliminating that.
I think it was you that has said this before, right? That we start with the current contract, and if this is current contract language, you're asking us to give up a right that we already had. And so I think that we should try to find a middle ground on this.
That's fine. If y'all want to think about it some
Yeah.
more and propose something that I think,
Yeah.
I think we all, learned from the experience that we had. So I
Yeah,
think
for
we're all
sure.
trying to kind of, I remember we were all sitting here being like, well, how do we square this with that? And then what makes the most sense? And I'm always just trying to make the contract a little bit easier for people to understand and like,
Mhm.
sometimes the more specific you can be in the particular articles is more helpful to people who are actually trying to, maybe it's.
Especially if something is rendered, if a law goes through that really changes something, like with an article that requires multiple sessions of bargain. We understand that, but if it's something we're not interested in changing until, all the courts, all that's been resolved. Then, that's fine, but I think I understand where.
Yeah, I think
Yeah,
we're all
I think we get what
Yeah,
you're
I think
saying.
we'll be able to
Yeah,
find
that's-
some common ground on this, yeah.
Okay, I think we've overstayed the.
No, that's okay.
Yeah.
I mean, if you guys have any other questions, we could ask them, but like I said, if it's okay if we could just call.
No, I think we need to debrief as well.
Okay,
Yeah.
all right. Thank you very much.
Yeah, likewise.
Appreciate the preparation and the work that you guys did to come to the table and have, thoughtful, meaningful.
Yeah, I think Derek
Presentation,
too.
really appreciate it.
For sure, yeah, no problem.
Who left this guy?
I'm sure you guys are preparing
Yeah,
for
definitely.
finals and that sort of thing. too.
So you don't have any papers to deal with, or research to try to finish before the break, or.
So should we switch over to the debrief room?
We can, I think,
There are only 5 people here and most of us are in the room.
Yeah, right.
yeah. I don't think we have to switch over.
Yeah, I think.
I can just stop the recording.
So.
And the other person is here that
No.
wasn't us who's back in, she's not, so.
Yeah, just
I'd
FYI.
be surprised if she comes back in.
Yeah.
Okay, that's fine.
Have a good weekend.
Okay, you
You
too.
too.